Selecting a rehabilitation care provider is the first step in regaining independence. It is the place where patients work to regain mobility, learn to remaster everyday activities, and strive to return home. The Acute Rehabilitation Program, located at Providence Holy Cross Medical Center in Mission Hills and at Providence St. Joseph Medical Center in Burbank, has been rated in the top 10% of hospitals nationwide in patient outcomes. Under the direction of rehabilitation physician Dr. Michael Lupo, both locations provide personalized treatment programs designed by a multidisciplinary team of specialists using the latest therapeutic techniques.
What rehab is and what sets it apart from other areas of medicine is a focus on improving a patient's overall level of function in order to get that patient back into a home and community setting. The patients that we admit to our program come in with a variety of diagnoses. Some of those typical diagnoses would be stroke, spinal cord injury, head injury, hip fracture, or patients that are simply very weak and debilitated because of prolonged hospitalizations with very complex medical conditions. One of the key things that we do in our programs is to work with families. The reason that's important is because when patients leave here, there needs to be a certain amount of continuity and carryover to a home setting. Our overall philosophy here in our rehab programs is ultimately to maximize each patient's level of function to the extent possible.
At Providence, patients reside in private rooms and receive 24-hour care from a specialized staff of rehabilitation nurses.
Rehabilitation nursing is different than nursing in other parts of the hospital because we know a lot about techniques that are taught to them by therapists, and we reinforce those things while they're eating, bathing, transferring to wheelchairs, back to bed. We have a community here of people who really do care about patients.
Physical therapists create a treatment plan aimed at increasing mobility and endurance.
We work on the patient's walking patterns, we work on strengthening their extremities, we work on their balance. We customize goals for every particular patient based on their prior level of function, and we ask the patient what their goals are for rehabilitation.
Each day, I feel better. Each day, a little better. Of course, they do with you each day a little more. It's the way they get you to walk, you know. The way they strengthen your legs, that's what gets you back on your feet.
I think when the patients come to an acute rehabilitation unit, I think what they're looking for is a lot of support, emotionally, psychologically, and physically, and that you're going to be able to get them to where they need to be so they can be as independent as possible at home.
Occupational therapists help patients remaster everyday activities.
Occupational therapy is a field that assists people of all ages in reaching their maximum independence and satisfaction in their everyday life.
Since I've had my occupational therapy, the passions that I've been able to resume have been walking, hitting some golf balls. I have been able to play some piano. The staff here was excellent. They were nurturing, they were kind. They made me feel important. They made me feel like they were focused on me and my recovery.
It is important. People need to be able to take care of themselves in order to go home and live by themselves or live with their family.
Speech-language pathologists can provide therapeutic services to improve communication and to ensure the ability to swallow safely while eating.
Our hope for every patient is that they can return to their normal life and that they can participate in the activities and in the meals and in the conversations they were participating in before.
I feel better about my speech. I feel like it's still coming back, but I feel like now I can talk to people. Some people don't even know I have a stroke, so that's a big thing.
Each patient's therapeutic team meets regularly to discuss progress and adapt the rehabilitation plan. In addition to the individualized daily therapy schedule, patients enjoy a variety of group activities guided by a recreation therapist. And both centers offer countless opportunities to learn new skills or adapt favorite activities that will allow patients to have an active, healthy lifestyle in the future. Providence also has a pet therapy program, community outings, and a multitude of support groups for patients, family members, and other caregivers. Family meetings with our multilingual care team, as well as psychological and spiritual support services are always available when needed. And because both locations are within medical centers, we are able to provide any required medical services on a 24-hour basis. As part of discharge planning, members of the rehabilitation team visit the home environment and make recommendations for safety and mobility. For almost 20 years, the rehabilitation program at Providence Holy Cross and Providence St. Joseph Medical Centers has helped thousands of patients throughout the greater Los Angeles area on their journey back towards independence.
This is really a wonderful place to go. It is wonderful.
I feel like they're family to me. I've come back here many times to say hello.
You can't get this just anywhere.
For more information, please contact our community liaison.